Welcome to this discussion or conversation starter around co-production. It's not meant to be a training video, but it is meant to be just an aid for frontline professionals to look at co-production and to give them the confidence to try it maybe in areas of their work where it is feasible to do so. So my name's Phil Pusey. I'm Chief Exec of Staffordshire Council of Voluntary Youth Services. And I've had the privilege over the last couple of years to facilitate a local conversation around co-production, which has resulted in the production of some tools. And at the moment, we're just working on how we align with Stoke-on-Trent because they've been on their same journey. So if you're not familiar with either pieces of these work, then hopefully on screen there you can see a link to both pieces of work. And so it's probably worth familiarising yourself with that, pausing this, coming back to this in a little bit. But you'll see there's some great work that's been achieved locally around co-production and encouraging the frontline practitioners to work with those that are receiving support much more than they have ever done so before. So yes, however, if you are familiar with that work, you're probably wanting to crack on and to look at this conversation starter around co-production. So without further ado, I'm using the co-production definition that we created in Staffordshire, but whether you're using the Stoke-on-Trent definition or a national definition, basically the same elements are in there. The wording might be slightly different, but the same ingredients, the same elements that make co-production what it is will be there. So hopefully you'll be able to follow it through whichever definition you're using. So it's not a new term, co-production, but it is obviously a term that is being used quite widely now. I think sometimes it's being used misused. So it's often used in settings where I sit, where to mean co-production, collaboration or partnership. Sometimes it's just a catch-all for engagement or consultation, whereas co-production is something unique. So let's have a look at what it means. And the idea is to break it down into some specific ingredients. So there's the whole definition that we use in Staffordshire. And this is how we're going to break it down and treat it a bit like ingredients for a cake. So there's 4 ingredients basically, which hopefully will produce a really good outcome. So the first ingredient that we need is the people that are responsible for providing support. Now, obviously, they can be frontline professionals who are working to support families or individuals. It could be their supervisors or their team leaders. It could be commissioners of the service that they are providing. Could be a grant giver who is giving a grant to provide that particular support. It could be senior officials in an organisation or an authority, strategic leaders, and even elected members who have to make decisions about things that can influence whether co-production is actually a feasible and doable approach for people. And it's across the whole system. And the Staffordshire Promise is actually been adopted through the Health and Wellbeing Board across the whole system. So that's children and families and adult social care as well. And so you have permission to use this approach in your work as and when it is feasible to do so. So the second ingredient is about sharing power, and perhaps this is the most challenging element, the most challenging ingredient. We've used just the word sharing power rather than equal power, which some definitions do use. For me, they don't recognise the kind of inbuilt power imbalances that exists between the structures that are providing services and those that are receiving them. So that's why we went for sharing power rather than equal power. And these couple of pictures might help illustrate a little bit about how people feel when they come up against the system. So they can feel powerless, they can feel very small and insignificant as the system makes decisions about them. And it's our job to not only work together with each other across, local authorities, health, police, voluntary sector, and wider, but also work with those people that are receiving support, make them feel as if their experience is valued, it's recognised, and actually can influence any kind of support that we're putting in place. So yeah, people feel sometimes they're passed from place to place, phone number to phone number. They often have to tell their story more than once. So there's lots of things that we can do as the people responsible for providing support to share our power, to work better together, and to involve and include those receiving support. And so you might want to think for yourself, where could you do this? Is there places where you're protecting your power? Are you willing to share it a little bit? And what does that look like in your setting? So when we're working with those receiving support, which is the third ingredient, obviously they can be children, families, young people, individuals, vulnerable adults, whole host of people who will be receiving the support that we're involved in shaping and providing. And we need to remember that the whole purpose of that support is to try and make life better for them, is trying to improve their circumstances. And so hearing, communicating well with them, listening to them more effectively, working better together, all of those things are critical factors in that. And it's always best to work with those receiving that support at every step, which is our fourth ingredient. So sometimes that can feel very uncomfortable for us as professionals. We like to be in control. We like to have a plan. We like to be organised. We like to show that we know what we're doing. So to walk into a room with a family, say to develop a personal care plan or something with them, and not have a blank sheet of paper where they've got as much say and influence as we have, it can be a scary prospect and can make us feel like we're out of control. So we need to have the confidence to say, actually, might be a challenge to us, but it's going to be good. And obviously, the idea is that by bringing those four ingredients that I've talked about together, you end up with the good outcome, the good cake, so that the help provided is as good as it can be and makes life better. And that's not just for people who are who are receiving the support. I honestly believe that doing things in this way can make life better for professionals as well. You can feel like you're doing a better job. You can feel like you're working with those people you're supporting rather than maybe butting up against them and constantly being in conflict with them. So that's the four ingredients of our co-production cake and the outcome that we hope to create. So just in conclusion, here's some things that co-production is and isn't. Co-production isn't just partnership working or collaboration. It's not consultation. It's not a quick and easy fix to something. It's not about doing two people. It isn't a tick box exercise or an afterthought, and it's not going in with a fixed plan. But it is about valuing meaningful lived experience. It's about seeing people as experts in their own world, citizens, not patients or service users. It's about sharing the power that we have as equally as we can. It's about a long-term commitment of time and resources, involving everybody that needs to be involved right from the very start to the finish of the process. And it's about positive change that makes life better for everyone. So if you've got any feedback or questions on this video, please contact me. There's my email address on the screen. If you found it valuable, share it with colleagues and watch out for more videos to come. We've got one due very shortly around how co-production fits into the engagement toolkit. If you're already practicing co-production and you want to let us know about it, we'd love to hear your story and to share it with others. Don't forget to pledge your support if you can. And thank you very much for watching.